All right, today we're going to talk about something that might be affecting you right now, and you wouldn't even know it. We're talking about vitamin B12. It's a nutrient that is absolutely vital for life, but it has a big secret. You see, it's incredibly difficult for our bodies to actually use it, and that can lead to some really serious health problems down the line.
So, what's the deal with B12? I mean, why is something so important, so hard for our bodies to absorb? Well, the answer isn't just about what you eat. It's about this incredibly complex and, honestly, kind of dangerous journey that B12 has to take through our digestive system. It's a journey where a lot can go wrong.
And listen, to understand the stakes here, you have to know what B12 actually does. This little vitamin is a total powerhouse. I mean, it's involved in building our very DNA, making the red blood cells that carry oxygen everywhere, and even protecting the coating around our nerves. Simply put, without it, our bodies just can't work the way they're supposed to.
And that brings us right to the heart of the story, what I like to call the B12 absorption gauntlet. And yeah, it's just as intense as it sounds. Think of it like a high-stakes obstacle course that this vitamin has to navigate perfectly to be any use to us at all.
Okay, so here's the main character in our story. B12 can't make this journey alone. It needs a special escort, a protein called intrinsic factor. This thing is basically a VIP pass, a master key. And without this very specific key, the door to B12 absorption stays locked. No key, no entry, period.
So let's walk through this wild ride step by step. First, your stomach acid literally rips the B12 out of your food. Instantly, it has to grab onto a bodyguard protein just to survive the intense acid. Only then, when it gets to the calmer small intestine, does it get to meet its key, the intrinsic factor. Together, they travel all the way to the very end of the small intestine, where B12 can finally be absorbed. It's so intricate, and if just one of these steps goes wrong, the whole thing just collapses.
You can probably see where this is going, right? With a system this complicated and this fragile, it's no surprise that things can and do go wrong. There are a ton of potential roadblocks that can stop B12 in its tracks.
So, what are these roadblocks? Well, a big one is a condition called pernicious anemia. It's a real curveball where your own immune system attacks the cells that make that crucial intrinsic factor key. But that's not all. It could be as simple as not getting enough in your diet, which is common for vegans and vegetarians. Or it could be GI conditions like Crohn's or celiac, or even common medications that just throw a wrench in the whole process.
And when that journey fails, when B12 gets stopped at one of those roadblocks, the fallout can be really alarming. It often starts with something you might brush off, like just feeling tired, but it can escalate into serious neurological problems, the kind that can cause permanent damage.
You know, the crazy thing is, it starts out so sneakily. You might just feel a little more tired than usual, a bit weak. It is so